I'm deeply impressed that so many people have turned out this morning to learn about healthcare, but I guess it's an indication of how important this is to us all personally and also in terms of the work that we do. We're all somehow affiliated. And I was interested this morning, getting up early, to hear on the radio 2 stories about healthcare this morning already on the radio. I want to explore some of those with you, and we'll all have a slightly different take on that. Anyways, the white paper that Andrew Lansley, the Secretary of State, published on the 12th of July, Equity and Excellence, Liberating the NHS, which has a trajectory to 2016, the full term of the coalition government, was described by the Bow Group as the biggest shake-up since 1948. So there will be massive changes as a consequence of this white paper, and I'm not sure we can see all of them at the moment. But let's look at some of the detail anyway. And it's a big document, but the key features, the actual cost of the changes has been adjudged to be £1.8 billion to spend on making redundancies, making the staff changes. There isn't one significant body out there. None of them have found it possible to fully endorse the proposals. And both the stories that have come out today reflect the fact that healthcare has financial difficulties. So in a sense, I think it's down to all of us to work out how to make this happen in the most constructive way possible. That's how I see it.
Social care seems to me to be a very important part of this, with health being one culture, social care being another culture, and actually getting the two to talk to each other is in my experience, very difficult.
You mentioned that the Minister is keen to develop the third sector, the social enterprise.
Yes.
And I'm just wondering if that is motivated by cost effectiveness, or whether it's just social value. He just feels that that's the way to move.
How is CQC going to cope?
How long do you think it will be before the first private 999 contract is awarded by the very same people who objected to their county ambulance services being swallowed up by the West Midlands ambulance service?
Now, it is a big sector, and Mark there answering a number of questions. There's a myriad of opportunities and thoughts and places that this sector can go to. But we have a number of relationship managers who just focus on the healthcare sector. So we want to be the bank that is the bank for this sector over time. So that's our aim, that's our aspiration. That's why we're involved this morning.
As Mark clearly said in his talk, very knowledgeably, there is so much change going on, and there are going to be many opportunities. There's going to be change which generates opportunities for advisors across the piece, and also opportunities for private sector, third sector providers to come into the health market.
A lot of interest in participating in the changes that are taking place. I would say the business community has got over the debate of whether it's right or wrong. They're just interested in making the best of it, which is probably the best place to be at the moment.
What we're most interested in hearing about is where maternity services will reside. We're concerned to hear that they may reside with GP consortia because long-term health is a priority within the community, and many of the things, particularly the NCT addresses, are long-term health issues, education for childbirth, breastfeeding, peer support, those kinds of things. You don't see immediate results of those kind of interventions.
I think health will remain active. There are going to be challenges. I think certainly social care, care homes, domiciliary care, that's going to become challenging as local authority spend, as Mark touched on, it gets squeezed even more than the stresses on the NHS spend. But yeah, for sure, there's still going to be opportunities.
The question that I will take away and think about most is the question of regulation that was raised by the guy who's running a private sector ambulance company. You know, faced with the prospects of regulation from the Care Quality Commission of the type that he will have to address in the near future, he's going to need some advice. And I'm going to have a talk with one or two of my colleagues who manage regulation and suggest to them that there's some real opportunity out there for them.